Turn to this now, developing now. OU's QB1, John Mateer, is having surgery today on his throwing hand. He hurt it in Saturday's win over Auburn.
Joining us live now to talk about this sort of thing, Integris Health surgeon, Dr. Rachel Hine. Dr. Hine, thanks so much. One thing that we don't want to do is put you on the spot and talk about an injury that you don't know very much specifics about. The university has not been specific about the exact type of injury.
A hand injury, that's what we know.
But you know hand surgeries. And so how serious, when an athlete undergoes some sort of hand surgery, is that automatically a serious thing?
Well, it depends, of course, thank you for having me. Depends on the injury. It sounds like they've released a little bit of information. We know that it's this throwing thumb and that it's a hand fracture. And so it's safe to say that he fractured one of the bones of his thumb without knowing specifics. And those can be common injuries in athletes. And typically we want athletes to return as quickly as possible. And so frequently they will undergo surgery in the form of open reduction internal fixation, which means oftentimes fixing the bone with hardware. And that hardware can depend. We typically try to use hardware that will get the players back as quickly as possible. It sounds like he'll be out 4 weeks is what they're expecting. And so I do think that there's going to be some kind of internal hardware used. And typically the hardware that we use is strong enough to get patients moving right away. And so athletes typically work on range of motion and pain control, and then they can get back to throwing. So that's probably my take on his injury. In general, athletes can have ligament injuries or fractures, and it all just depends on the type of injury and recovery.
Dr. Hine, does it give you any insight, or as an OU fan, does it give you any hope that he was still able to play after injuring that hand and playing well? Does that give you any insight on the severity?
I mean, the first couple games gave us a lot of hope. I'm a proud OU alum for college. We're finally having a great season. And of course, we have a setback here. I do think that his return set at 4 weeks is really promising. Typically ligament injuries are far set, 8 weeks, 10 weeks, or even carpal bone fractures. And so the fact that they're saying 4 weeks makes me a little bit more confident. I'm sad he's going to miss the OU Texas game. I'm really looking forward to that. But hopefully we can get him back safe. He recovers quickly.
Is there this is a two-parter here. So it sounds to me like, some people might think, oh, a break is worse than a ligament injury. But you're saying, no, absolutely, a break is usually better. And then also, is there any chance, I know you're saying he's going to miss it, is there anything that could speed up the recovery or, on the other hand, slow it down?
So many questions. So when you
I know, I apologize.
Well, no, you're fine. When you think about fractures in general, bones take about 6 weeks to heal. And we try to do everything in our power to make bones strong enough so that patients and or athletes can get moving quicker. And so, his bone will not be healed at 4 weeks. But if the hardware that they use is as strong as an intact bone, then he could potentially get playing if his motion's good and he has no pain. As far as ligament injuries, those take longer to heal because you're trying to get a ligament to heal to a bone instead of bone on bone healing. And so oftentimes those can take 2 or 3 months, especially if it's, in your wrist, you're talking about wrist stability, or even like the Drew Brees operation, the UCL tear, those can take 8 to 12 weeks to heal. And then of course, we're trying to repair those in a way that gets those patients back quicker. And so I would say in general, if the fracture does not involve the joint, it is better than a ligament injury as far as time to recovery.
Lastly, what will recovery look like? Will he be in some kind of cast, a protective sort of apparatus around his hand? And what are you thinking about an injury like this long term?
Yeah, totally. So when you have a fracture, if the hardware is strong enough, oftentimes patients don't need a cast or splint. That's usually to protect, any kind of repair or fixation you do. If they don't need a splint, then you can potentially get moving right away. Swelling starts to subside 2 to 3 days postoperatively. He'll get in therapy pretty quickly afterwards, get range of motion, a lot of compression therapy for swelling. That's what we're going to be fighting the first couple weeks. And then he's going to be working on motion and strength. And so they're going to try to speed all those things up. We think about recovery, we think of, the skin healing, the swelling, then we start thinking about motion, then we start thinking about strength and making sure, that bone is strong enough to withstand all that. And so that's kind of his phases of recovery. And I'm hoping, if he is pain-free and has a good fixation, he could potentially get back earlier, although 4 weeks is quite early.
Dr. Rachel Hine, a surgeon with Integris Health. Doctor, thanks so much. We appreciate your insight.
Of course. Thanks for having me.